So one of the big problems we have here at the hospital is we've got significant waiting times for appointments at the hospital. And one particular aspect of that was that we had a lot of patients who are failing to attend for their appointments. And we have certain expectations around how many patients our physicians should be able to see within their clinic. And if patients fail to attend, of course, they're not seeing the optimum number of patients. And we had this idea that we could probably look at failure to attend and try to model whether or not we could actually ask more patients to attend for clinics based on the predicted number of patients who would fail to attend, allowing us to essentially overbook clinics, much like an airline does to overbook passengers, but with a certain number of patients who we then would be able to find a slot in a more timely fashion. With this particular project, patients who've been on the waiting list will get access to a clinic visit sooner than they would have before. And that's good for families. And that's some of the feedback that we've been having from families, is that they're very satisfied that they've been able to see a physician sooner than they thought they would.
The contact centre is booking patients into the Access Clinic. These patients are from the wait list, the routine wait list, where patients have been waiting a little while, would normally not get an appointment as quickly as this. The project started about 10 weeks ago, and we've already decreased the wait list by about 120 patients. Some of them have been booked into the Access Clinic, and others that we've rang have said they no longer needed their appointment. So it's a twofold sort of success there.
The tool works by conducting statistical analysis on each patient who's booked into an outpatient clinic. It estimates the risk of attendance, non-attendance, early cancellation and late cancellation. The tool then takes that information to produce a recommended number of extra patients to add to the clinic, such that the risk of over-attendance is constrained. Essentially, the tool learns as more data comes to light or more information becomes available, and therefore our models can be more accurate, and typically that results in a higher number of recommended patients that we can add. Going forward, we're looking to hopefully scale to other clinics within RCH, and we're finding it looks to be quite transferable to other hospitals too, so we do hope to scale it across Victoria.
We think that this project's really innovative. It's utilising some of the available big data that we now have to be able to model and forecast what's going to happen with people turning up to clinics or not turning up to clinics, so that we can actually fill those vacancies ahead of time. What we're actually seeing in practice is that something like about 66% of the people that attend to these clinics are being seen within 30 minutes. So that's a really good outcome for patients. They're not having to wait for months. They're actually being seen in a very short space of time.
Without the funding from Better Care Victoria, we simply wouldn't have been able to do this project. The funding has been absolutely critical to allow us both the time and the resource to really strike a new innovative way of doing things differently at the hospital. And we're always looking for ways to develop more innovation, and therefore really welcome collaborating with Better Care Victoria to try and improve the health care for patients and their families.